Hi, everyone. This is Mary Curick with Frontrunners Innovate magazine. And with me today is Brianna Greenspan. And Brianna, you're in Texas, right?
I am in
Did I get that
Texas.
right? Yeah. Well, we are sitting with you today because you have some extraordinary knowledge, and we want to get the backstory first because you are sort of a patient advocate coming from a patient yourself with sort of a condition, a rare condition that created a scenario that you literally had to kind of find your own fix. And it's such an interesting story and journey and so motivational, inspiring. We want to start there first and then bring people up to where the educational piece needs to be with what you've got going on there. So let's not give away too much. So if you'll start with your own story.
Absolutely. Thank you so much for having me on. I'll start by saying, hi, I'm Brianna Greenspan, and um, the first 21 years of my life were kind of like a medical roller coaster. I was in and out of doctor's offices, in and out of the hospital, taking tons of medications, being guided in being misguided in many, many different directions. And as a result, I wasn't getting the care that I needed, and I was consistently becoming sicker and sicker. And the amount of symptoms that I was experiencing were multiplying in ways that, we weren't really sure, was that something that I was just experiencing, or was that a side effect from the medications I was taking? What exactly was happening? And by the time I was diagnosed with Ehlers-Danlos syndrome and mast cell activation syndrome and a type of dysautonomia called POTS, it kind of like put all of the pieces together for what I'd been experiencing my whole life and how misguided my health journey had been. Had we understood what I was experiencing right off the bat, we would have been able to give me the care that I needed to help me become my strongest self immediately, versus taking all these roundabout directions and having all of these other issues come up. And so I learned that I really needed to be my own researcher, my own advocate. I really needed to stand up for the things that I was experiencing. And eventually I got to the point where I had retired the neck brace and the wheelchair and the handicap placard and the heart monitor, and had instead found my own voice and said, I'm no longer going to go to see physicians that have never heard of what I experience. I'm no longer going to be somebody who is at the willy-nilly of whatever, local physician that so-and-so suggests, when they don't actually understand what I'm going through. And I started getting really quality care. And I started finding solutions that could help me be my strongest self. And that kind of changed everything and snowballed into more research and more advocacy and supporting myself and others in grand ways that I had never really imagined. Yeah, and I'll leave it there. I'll leave it there
Okay,
for a
well,
moment.
good, because what I wanted to do is go back to the disease that you were diagnosed with. And could you tell us a little bit about what that is, what it does to you? And I think if there's a genetic component historically with family or whatever, let us know about that.
Yeah, so originally I was diagnosed with fibromyalgia and chronic fatigue, and they elevated that to an Ehlers-Danlos diagnosis. And with that, all of my joints dislocate. Ehlers-Danlos syndrome is a connective tissue disorder that affects the collagen in your body. So I have widespread chronic pain, my joints dislocate spontaneously, like I'll cough and a rib will come out kind of thing, which is like, I'm constantly trying to stabilize, make sure that all my joints are in place and stay in place. There's a lot of bruising. There's a lot of spontaneous sensitivities. Like I'm very sensitive to temperature change, and there's just a lot that comes with that. And an offshoot condition is mast cell activation syndrome. And I used to tell people, like, I feel like I'm just allergic to myself. If you hug me, I'll break out in hives and like a little bit of a rash, and like my skin is just very, very sensitive. I'm very sensitive to chemicals and to all kinds of things in the external environment. And so I really have to be guarded about where I go and how I protect myself and what I'm putting in or on my body. And I'm very mindful of the ways that I show up. Like if I have my arm on my leg, my hand on my leg for too long, I'll just break out in hives, that kind of thing, just very sensitive. And it used to come up in really interesting ways. My mom didn't really understand. I would say things like sheets hurt me or jeans hurt me. Like, mommy, the tag is really bothering me. And it just didn't make that much sense. But when finally I got this MCAS diagnosis, it all clicked. And almost all of the patients that have MCAS feel that same way and say these types of things. They're very sensitive to certain materials and etc.
Did you tell me that there was somebody in your family also had the same thing or something similar?
Yeah, yes. So Ehlers-Danlos syndrome is genetic, and so are all of these comorbidities that come along with it. And so my mom is also very affected, and that was a really interesting journey all in itself. Every specialist that I went to, she would, butt in to talk about but some similar but different issue. And a lot of the things that I experienced when I was younger, she started experiencing a little bit older. And so I grew up feeling affected my entire life. But she was klutzy, clumsy, had issues, but she was kind of fine until her late 20s, whereas I was born really, really struggling. And so we could see the similarities of what she was getting in her 20s and 30s and 40s that I was getting in my teens and so on. So she's now in her 60s and is greatly affected, very, very sensitive. The other thing I didn't mention is the dysautonomia piece, where it's triggered by trauma or infection. And so after I would have some kind of weakened immune system issue, I would get this thing that when I'd stand up, I'd feel dizzy. I'd get these crazy headaches. I'd have these experiences that kind of took me out for a long time. People thought it was a migraine. And eventually we learned that it was a dysregulation of my autonomic nervous system, and that there were really easy fixes for that, if I went through the motions. And so I started finding all of these different habits and rituals and therapies and modalities that could support me eliminating or minimizing these symptoms that I have. And so now I try to inspire my mom and other people who have these types of challenges to know that there are so many resources out there that they weren't offered at the beginning of their journey.
Yeah. What I think is really interesting about what you did, because I kind of, when you and I first talked, I thought about my daughter who has Crohn's disease, and she, started realizing that in her, I think, early 30s or late 20s. And she did like you did, which is, I'm going to find out everything I need to know about this because it's crazy. And it's kind of like, I likened these things to like diabetes that attacks every different little thing and presents in symptoms, not necessarily the same with every person, but in these broad, unrelated, weird lesions on the leg, hump on the back of the neck, all these weird things. And, it's one thing dealing with the whole person and the whole disease, but it's another thing dealing with all these little weird symptoms that keep showing up. And it does change your life. And it changed hers from the standpoint of she had to kind of get out of the job that she really loved and find something else that was going to work for her. But she became her best advocate, her own best advocate. And that is what you did. And what I liked about what you said is you actually, once you realized what was going on, and maybe you had gotten fed up to the point where you were going to find a doctor that was the best you could find that dealing with exactly this, and not this and 10 other things, but exactly this. And when you did that, certain things started to happen that put you on the path that you are on now from a career perspective. Share a little bit about that, if you will.
Yes, thank you so much for bringing that up. It was the first time that I ever felt seen or heard, to go into a doctor that said, "Oh, you're not crazy. This isn't in your head. I totally know what you're experiencing." I have the physician that I ended up having as my primary care doctor. He had 63 other patients that had Ehlers-Danlos syndrome. And so he had heard a lot of the things that I was expressing over and over and over again. So I wasn't like this oddball that he needed to research, or he really got it. And from there, because I also mentored kids with chronic and terminal illnesses, I not only understood what I was experiencing, but I had a little bit of awareness about what other people were experiencing in the same realm of invisible and chronic illnesses. And so one day I saw someone who was suffering massively, and when I was in college, and the school thought that she had a drug addiction. And I immediately knew that she was that she either had complex regional pain syndrome or erythromyalgia. Like it just went off like a light bulb, because I had mentored kids with this type of issue. And I said to her, I think that I'd like to bring you to my physician and see how I could best support you. And from there, the physician said, wow, you totally changed that girl's life. She was, you know, on a downward spiral. The school was thinking of kicking her out, and they had really, you know, they did not understand what was going on. And I just said, it doesn't matter what drugs you're on. You don't walk on dislocated ankles and have blue feet and just like have this burning situation, you know, just whatever she was experiencing. I fundamentally understood. And from there, I started just seeing people everywhere that were suffering in silence and saying things like, hey, did you know that there's a physician that might be able to support you on this? And at that point, I had a network of physicians who either treated me or treated those that I was mentoring. And so I started referring patients to these doctors. And the one doctor who I was working with, after the third patient I referred to him, he said, would you like to intern in my office? Would you like to do your science credit in my office? Let's do something together. And so I became his pseudo wellness consultant for a semester. And eventually he went to the chief of rheumatology and said, I've got this girl here who puts puzzle pieces together and is really, you know, changing the trajectory of how my patients are being able to show up as their strongest self. I want to do something with her. And so they ended up proposing that we publish a study on the diagnostic process of Ehlers-Danlos syndrome. And from there, it kind of snowballed. Another researcher asked me to be his sidekick at some medical conferences, because he realized that if I was supporting him, I'd be able to shave off between 8 and 12 hours of the diagnostic time for these incredibly complex patients. And after a while, I got a phone call from the chief of the National Institute for Allergy and Infectious Disease. And he said, hi, Brianna, I heard that you're a friend of the rare disease community. And I discovered a condition that I think affects 5% of Caucasian people. And I'm looking for a strategic partner in order to get a genetics collaboration and also bring this research to the world so that other researchers can either validate it or say that it's hullabaloo. And I said, how did you hear about me? Wait, what is happening? And he said, I called the head of Dysautonomia International, and she said that you're a friend of the rare disease community, and if you can't help me, you'll know somebody who can. And I thought, what a beautiful way for me, like coming full circle, what a beautiful way for me to use my connecting skills and to use the life experience that I have to support something that is so much bigger than me. And then he went on to say that he thought that I might have this condition, but even if I didn't, these people felt the same way that I did. And it just pulled at my heartstrings. And I knew right then, even if I didn't have this condition that he was talking about, that I definitely needed to, you know, use my expertise in any way that I could to support him. So that was 5 years ago. And in the last 5 years, the hereditary alpha tryptosemia condition has been completely validated internationally. There's now 11 papers on PubMed about it for any patient that has elevated serum tryptase that's in a chronic constant allergic state, anybody that needs an EpiPen. These are the types of patients that should be looking into HATs. And so it's been an honor and a privilege to work with researchers and physicians across the globe, educating them on that the diagnoses that they've given their patients probably missed the mark. And as a result, their management and therapy are probably not supporting them in the ways that they could. And that's a little bit about where I'm at now.
What is the treatment for that condition you said that was 5% of the Caucasians in the world likely have? And I know you and I talked, and you said just basically anybody who has to use an EpiPen pretty much, or is one of those people you say, hey, because I remember telling you there's somebody in my life, and I've got to put my head to it, that I've always said, you know, you're just allergic to everything. And people like that is who you're talking to right now, is who you want to get to. But what is the fix for that?
Yeah, so I'll just elaborate real quick. It's patients that have mild to severe allergic reactions, plus widespread chronic pain, plus autonomic dysfunction, plus gastrointestinal issues. So they're often misdiagnosed with the things that I actually have. They're misdiagnosed with Ehlers-Danlos syndrome or fibromyalgia and mast cell activation or gastroparesis or some kind of dysautonomia or anything like a lower level diagnosis like, oh, you just have anxiety and chronic fatigue. And we don't know what's going on with your allergies, take a Benadryl. So, and so the treatment for it is ever evolving as research is evolving, but I'll say that there's two options for where a patient would possibly get diagnosed. If they've been completely and totally disregarded and they are self-medicating with Benadryl, Zantac, Zyrtec, Allegra, they're self-medicating with over-the-counter H1H2s, and they're not even able to get prescription H1H2s, then this diagnosis is going to catapult them into the category that they're now getting the full validity for what they're experiencing. They probably are going to be able to get on the prescription H1H2s that are out there and available right now. And so that for this patient group is a huge step forward. Unfortunately, for the patients that have already been, misdiagnosed with something like mast cell activation syndrome, they're already on prescription H1H2s. And so for that category of patients, there isn't another medication per se that doctors are suggesting at this time, although there are clinical trials that are going on right now for HATS patients specifically. And so in the future, we know that we'll be able to support them even more than they are right now. So the main thing that people are saying is that this is a test, this is a genetic test that for the first time they can feel seen and heard and completely validated. People aren't saying, you made this up, this is in your head, you're totally crazy, or we disregard what you're saying.
Years self-medicating, I'm sure.
Yes.
To deal with it, because what you're doing is just throwing over-the-counter meds at a symptom and not really addressing the whole problem. And that kind of comes back to the full circle message here is being your own patient advocate. You are like a walking story role model for that. And I was going to tell you, like I said at the very beginning of this, I loved, my grandmother died at 100 years old. That was her aim, to get to 100 years old. She made it. During the course of that period of time, I remember taking her to her doctor and sitting her down in her cute little hat and her little stuff. She was completely blind, had her mind totally about her. Sat her down, and the doctor came in and he said, "Oh, Miss Mary," I'm named for her, "Miss Mary, how are you doing?" And she looked at him without any eyesight, but she moved her head to him and said, "That's what you're getting paid to tell me." So that's the mindset of a generation of people who is so glued to, and I'm not saying you should not be listening to your doctors and that sort of thing, but is so glued to the professionals that they see as getting paid. They've got the certificate on the wall, they've got all that. My mother was the same way. They know best. And what I think is really interesting is even my mother, when she was experiencing some serious conditions, would not bother her doctor until the set appointment that was made. And it's like, Mom, that's 2 months from now. You're going to wait 2 months when you really need to address this right now? Yep, that's what we're going to do. So there's a generation that believes in then putting the entire responsibility for their health on the professionals there. And really, even the professionals, I think, would like you to be more participatory in your own health. And so to that end, I think especially when it comes to rare diseases or diseases that are rather expansive in what they can attack in your system, being able to become your own best patient advocate, especially when diseases don't present the same way with every single person. I mean, some of them do, but you're an individual, so who knows what else it's going to present there, is being able to step up and be your own patient advocate in that way. Learn everything you can. And if something's not working, then keep pushing to find out why it's not working and what needs to happen. What I like about this interview with you is not only that you're a champion of that, but we wanted to get that information out about this new condition and the diagnosis for it, and have people being on alert for that. So Brianna, where can they find out more information about this? How can they connect with the source of info?
Yeah, so on the National Institute for Health's website, they have an FAQ about hereditary alpha-tryptosemia. They have an announcement. They have a bunch of studies that they've done, and and other studies on PubMed. And if any physician is looking to order the testing for their patients, genebygene.com/tryptase is where you'd find all the information about it. We also have, some of that same information from the NIH on that site as well. But that is the home of tryptase genotyping information, and where you can, explore more and figure out what could be best for you or your patient.
Fantastic. And we definitely want to encourage people to do that. From a standpoint of other innovators, because we all are, about innovation out there and solving the world's problems, and we do have developers of such out there. Do you have a message for anybody who's innovating solutions that might tap into this, this space at all? Maybe app development and anything like that you can think of that would make it easier for a patient.
Well, there actually are so many solutions out there, like patientslikeme.com or emotional solutions like the Mighty. And I've heard of many different apps that are out or coming out, whether it's facial recognition software, you put in your symptoms, or, you put in your whole exome or genome sequencing, and it kind of gives you a little bit more information. But for anybody who's in the healthcare innovation space, my first thing is to say thank you. We are so ignored and so fragmented in the chronically ill space. And for anybody who is really has the heart to take on creating actionable solutions, I'm so grateful, because there's so much room for innovation in the healthcare space. And it's actually, there's so many gaps within it that there's a wide range of opportunities for someone that is interested in this type of space or has the knowledge or know-how.
Right. Well, if you're hearing this and you're interested in collaborating or partnering with Brianna and the folks that she's working with and on chronic or rare diseases, get in touch with us, or you will drop in her LinkedIn profile link, and so you can connect directly with her. And thank you, Brianna. I appreciate it very much. This is great, very useful information, and especially during a pandemic when we know this type of condition could really cause real problems for somebody who ended up contracting COVID. And so, during a pandemic, paying attention to this, being your own patient advocate, understanding that there might be other things going on that get worse if you're having a chronic situation, and that you're really self-medicating with it when there's something bigger and better that you need to be doing. So thank you, Brianna. Appreciate it.
Thank you.